Hello friends, this is Dr. Manjunath, your FMT Guru. Welcome to FARRE series. Welcome to the topic Mechanical Asphyxia and Toxicology Spotters. Hi everyone, good evening Rakesh, good evening Soham, Kushal Patil, Muhammad Shahid. Am I audible and visible? Audio, video, is it clear? How is your preparation? How is your third year preparation? Forensic medicine, legal medicine, state medicine. Okay. So I divided entire FARRE series into 8 classes covering almost 90% of the forensic medicine and the important concepts that is very commonly asked in FMT university exam. In these 8 sessions, I'm going to discuss all important images, the spotters, important Viva questions, important long essay, short essay, and short answers. So let's make it interactive. I'll go a little slow or moderate speed, don't worry. So interact with me. You can keep me awake. You can keep yourself awake in the forensic class. Yes guys, I'm audible. Okay, good evening Ranjan, Isha, Vipin, Kushal Patil, Darshan, Akash. Kushal Patil, how are you? How is the preparation going on? Rakesh, how is the preparation going on? Okay, fine. So mechanical asphyxia, there are 4 important topics. One is hanging. The second one, strangulation. The third one, suffocation. Lastly, very important, very commonly asked, dairy milk question, drowning question, very important. So drowning can be main question, hanging can be main question. Suffocation can be 5 marks, working 3 mark, mugging 3 mark, garroting maybe 3 mark. So very important topic, very important in forensic medicine and very challenging. Okay, chalo. So let's start. Long essay. Let's start with the important long essay. The repeat question asked in your university exam. Define hanging. What is asphyxia triad? Types of hanging. Causes of death, postmortem findings, and medico-legal importance. Dear students, to get distinction in forensic medicine, what is important is medico-legal importance. Try to write medico-legal importance in every question of forensic medicine. MLI, suicide, homicide, accidental, difference between suicide and homicide, suicidal hanging, homicidal hanging, or sometime accidental hanging, like example autoerotic hanging, drowning, suicide, homicide, accident, anything can be possible. So what is important in your prof exam is medico-legal importance, MLI. So all of you just type MLI in your chat box. MLI, medico-legal importance. So hanging definition, so around 2 mark. Asphyxial triad 2 mark. Types of hanging 2. Cause of death 2. Postmortem finding maybe 2 or 3. Medico-legal importance, it's basically a scoring part of the answer sheet. This is how you should write. MLI, बहुत बढ़िया. चलो आगे देखते हैं. Hanging definition. So definition given in standard textbook. The standard textbook we follow K.S. Reddy, R. Rajesh Bardale. Any book is fine. So the definition given in standard textbook 35th edition K.S. Reddy, page number 262, states that is a form of asphyxia caused by suspension of body by a ligature material encircling neck, the constricting force being weight of the body or weight of the head. So this is the proper definition you need to write in the exam. Now the question can be asked in exam, what is asphyxia? Asphyxia means combination of hypoxia and hypercapnia. Hypoxia and hypercapnia. As you know, hypoxia means decreased oxygen concentration. Hypercapnia means increased carbon dioxide in the blood. But in general, remember, the literal meaning of asphyxia is pulselessness. Pulselessness. MCQ. Suspension of body. Suspension of body present only in the hanging. Absent in ligature strangulation. Absent in LS. Body suspended in case of hanging. Absent in ligature strangulation. Very important concept. Ligature material can be anything. It can be wire, it can be soft ligature material, or it can be a charger, whatever that is. So ligature material. But remember, when ligature material is soft and when it is broad, sometimes there can be very faint ligature mark. A question can be asked in Viva, hanging without ligature mark. Your answer must be soft ligature material. Hanging without ligature mark. Very interesting question. Soft ligature material. Encircling neck. So encircling neck, remember, oblique in nature. A classical hanging, oblique in nature. Oblique ligature mark. Very important point. The constricting force being weight of the body in complete hanging. Weight of the head in case of incomplete hanging or partial hanging. The weight of the head 10 to 12 kg, that is the constricting force that leads to asphyxia and death. Again, the question can be asked, what is the weight required to occlude trachea? Can anyone try? What is the weight required to occlude trachea? Vertebral artery, jugular veins, carotid arteries. Try anyone? Let's make it interactive. I said in the beginning, it will be of more interactive session than of monotonous one-way teaching. ठीक है? Darshan, Kushal Patil, Mohammad Shahid. हाँ, very good. 10 kg trachea, excellent answer. 10 kg. Kushal Patil, great answer. Vertebral artery around 30 kg. Jugular veins 2 to 3 kg. Carotid arteries around 5 to 6 kg. Okay, so this is very, very important point. Okay, so this is definition. Asphyxia triad is basically A is equal to CPC. Any asphyxia, okay, strangulation, mugging, working, any asphyxia, choking also. The common findings are CPC. A is equal to CPC. C means cyanosis, C means congestion, P means petechial hemorrhages. So, C means cyanosis. Cyanosis occurs because of deoxyhemoglobin when it is more than 5 gram per deciliter. Petechial hemorrhages, also known as Tardieu spots. Then also congestion. All the organs are congested in case of hanging. You take brain, you take spleen, lung, all the organs are congested in any case of asphyxia. A common finding, non-specific finding. So I'll have to write in the chat box, A is equal to CPC. So write along with me. A is equal to, asphyxia is equal to CPC. Okay, बहुत बढ़िया. चलो हो गया. Next, types of hanging, very important. Based on the suspension, so it can be complete hanging, partial hanging. Based on the manner, It can be suicidal hanging, homicidal hanging, accidental hanging, or it can be judicial also. Suicide, so that is the commonest type. It can be homicide, the homicidal hanging known as lynching. Lynching means homicidal hanging. It can be accidental in case of sexual hanging, autoerotic hanging known as Courtsvarism. Judicial, so especially death sentence in India. So death sentence given in various conditions, especially rape and murder, rape and PBS, rape on a girl of age less than 12 years, repeat offenders, planned murder. So there are many indications for death sentence. So judicial hanging is actually the one type in India, right? Based on the knot, it is classified into typical hanging, atypical hanging. Can anyone try what is typical hanging? Typical hanging, what is that? Try. Let's make it interactive. Okay, Kushal Patil, Akash KS, Ranjan, Rajesh, Darshan. Typical means what? Typical मतलब क्या है? मतलब knot कहाँ होता है? तो typical में knot कहाँ होता है? It is on the right mandible, left side of the mandible, or over the chin, or over the occiput. This is important Viva question. So typical means, remember, the knot occurs at the occiput or the nape of the neck. Nape of the neck. In case of judicial hanging, the position of knot is below the chin, submental position. Viva question, MCQ in your exam, university exam. What is the site of knot in case of judicial hanging? Your answer must be chin, below the midline, that is chin, submental position, below the mentum, submental. Okay. Now just to simplify, there are three important images are there. You need to identify what are these images in case of hanging. Look at the first image. The first image, you can see the cerebral vessels, they are congested. So this is classical case of asphyxia. In the second image, you can make out pinpoint hemorrhages around the 0.1 to 0.5 millimeter. They are commonly seen over the loose tissues. Like example, conjunctiva, sclera, over the heart, over the lung, tardive spot. And image number 3, very important image, that is cyanosis, the bluish discoloration. So all these points must be there in your exam. So this is how you should write. If you write these points, you will get 3 mark. 3 mark for sure. Okay? Yes. ठीक है, Kushal Patil and others. That's okay. Chalo. Now you need to identify what are these types of hanging. Look at this. So this is complete hanging. You can see here. So this is complete hanging. This is incomplete hanging. The knot is at the nape of the neck, typical hanging. Submental position, judicial hanging, and atypical hanging. So everything in one picture. So after the class, go through this. There are 5 images given to you. Okay. So complete, partial hanging, typical hanging, atypical hanging, and also judicial hanging, submental. So is it clear, guys? Say yes or no. Yes or no. So Rakesh, Srinivas, So the next important topic is postmortem findings. So what are the postmortem findings in case of hanging? So postmortem findings in exam, you need to write external finding, internal finding, cause of death and manner of death. Okay. Yes. So, chalo, Ranjan. Postmortem findings. External face. The face is either congested or pale. Pale in case of complete hanging. Congestion in case of partial hanging. Tongue. Tongue is protruded. Why protruded? क्यों होता है? Because of the increased pressure inside the larynx, oral cavity. Angle of the mouth that shows dribbling of saliva. So, dribbling of saliva is one of the classical feature of antemortem hanging. One of the very important feature of suicidal hanging. So it is the surest sign. MCQ. Neck. Neck, most of the cases, it is elongated. No injuries on the neck. If injuries are there over the neck, other than the ligature mark, it go in favor of strangulation, ligature strangulation. Tardive spots, commonly seen over the conjunctiva or over the sclera, over the heart, over the eyelids. Are they specific? Non-specific. They can be seen in case of scurvy, bleeding disorders. Okay. Postmortem staining, that is usually in case of gravity area, that is glow and stalking hypostasis. Glow and stalking over the lower part of the upper limb and lower part of the lower limb. Sphincter relaxation, so there can be urination or defecation, or sometimes there can be seminal discharge. So because of the relaxation of sphincters. Internal finding, when you see the neck basically, so there will be oblique ligature mark. Oblique ligature mark above the level of thyroid cartilage in 80% of the cases, and it is incomplete, not complete. And when you see the base is dry hard parchmentization. There will be dry hard parchmentization. So very, very important. In case of strangulation, so try to understand, in case of strangulation, ligature strangulation, so the base will be soft and reddish. So when you open the neck at the midline, so there will be collection of blood, extravasation of blood, a large hematoma that can be seen over the subcutaneous tissue. But in case of hanging, dry hard parchmentization. Okay. Then hyoid bone. So hyoid bone, so there is a fracture. The fracture known as outward fracture, outward compression fracture at the junction of anterior 2/3 and posterior 1/3, usually at the greater carbo, greater horn. Outward compression fracture, but is very commonly seen after the age of 40 years. Then carotid arteries, they show Amsous sign. Amsous sign. That is the transverse tear in the carotid arteries. vertebra fracture can be seen. C2, C3, C4 fracture known as hangman fracture. Hangman fracture also known as C2 fracture. Try to memorize undertaker fracture, that is C7 fracture. C2 hangman fracture. Thoracic vertebra, there can be hemorrhages. The hemorrhage is known as Siemens hemorrhages. Lungs are congested. Brain congested, liver congested. So most of the organs are congested. So yes, okay. Can anyone tell me what is the cause of death in case of hanging? What is the cause of death in case of hanging? Chalo. Come on guys. What is the cause of death? Let's write here. Cause of death. Let's make it interactive. Kushal Patil. AMSU sign is transverse tear. So example, this is carotid artery. In carotid artery, you will see transverse tear like this. Transverse tear. So very commonly seen in judicial hanging, not in case of suicidal hanging or homicidal hanging. Okay. Cause of death, can anyone try? Okay, Lion is telling, sir, venous congestion. Bahut badhiya. So cause of death, either it can be asphyxia, venous congestion, sometimes it can be cerebral anemia or vasovagal inhibition or cervical vertebra fracture. Cervical vertebra fracture. This is the cause of death. Good. Okay. Now, the manner. Manner is also important. You need to write manner in exam. Manner is. What is the manner? Most common manner, suicide. Second most common can be homicide. Third most common, that is basically accidental. It can be judicial also. Judicial. So this is how you need to write the answer in your answer sheet in exam. So neat answers, clean answers, point-wise answer. So what matters in exam is the point-wise answer. External finding 1, 2, 3, 4, 5. Internal finding 1 to 7. Cause of death, the manner of death. So this is how you need to write. Okay guys, can you able to write in exam? Chalo. Now look at this. There are 4 images are there. So you need to identify what are these 4 images. Try yourself. So in the first image, a case of hanging. Okay, a case of suicidal hanging. You can see the tardive spots. You can see multiple hemorrhages are there. In the second image, so one eye is open, other eye is closed. The pupil is more dilated on the same side. What is that? And third picture, that is a reddish purple appearance of the lower limbs. And the fourth picture, that is dribbling of saliva. Identify all these images. Let's see one by one. Your turn to answer. Okay. Okay, first one, Kushal Patel is telling, sir, this is tardive spot. Tardive spot. This is lay facies sympathetic. Dribbling of saliva. This is postmortem hypostasis. Okay. Yes. Great. So many answered. That's really nice. Okay. So next question, the question asked in, okay, this is about the main question. Guys, this is how you should write. Okay. Definition, asphyxial triad, types based on the suspension, manner and the knot. Then images, postmortem finding, external and internal finding, cause of death and the manner of death, and few points. Okay. Is it clear, guys? Is it clear? Yes or no? Yes or no, guys? Kushal Patil, Rakesh, Akash, Harsh Kumar. Yes or no? Yes or no? I'm waiting. I'm waiting for your reply. Clear. Mohammed is telling clear, sir. Lion is telling clear. Srinivas, sir, glow and stalking. हाँ. Glow and stalk मतलब collection of blood in the dependent area. That is lower part of the lower limb. Uh, socks है ना? Socks hypostasis. Glow and stalking hypostasis. Glows and socks. So that is the common site. Yes, yes, बहुत बढ़िया. ठीक है. So guys, forensic, forensic. You don't like what forensic likes you. You can't avoid. Such an important subject, such an important medico-legal subject. Forensic medicine likes you. You can't avoid. Do you agree with me? So the knowledge of forensic medicine, knowledge about the law, to give you a lot of confidence in exam. Like example, Bharatiya Nyaya Samhita, Bharatiya Nagarika Suraksha Samhita, Bharatiya Sakshya Adhiniyama. As a doctor, as an expert, you must know. So there can be case of medical negligence. There are hundreds of medical legal cases. In every medical legal case, there is a need of doctor's opinion. You are an expert witness. Okay? True. Yeah. It doesn't indicate hanging. It's non-specific. Harsh Kumar, it can be seen in other conditions also. Okay? Not exactly the feature of hanging. See, forensic medicine opinion based on many findings. So it revolves around entire dead body. So dead body going to give you clues. It's analysis of findings, not based on single finding, multiple finding. Dribbling of saliva is there, oblique ligature mark is there, depression is present, organs are congested, left face is sympathetic is there, go in favor of suicidal hanging. Multiple injuries are there, oblique ligature mark is there, probably homicide. If a person is engaged in some masturbation, he was suffering from transvestism, seminal discharge is there, partial hanging is there, protective padding is there, then it is autoerotic hanging. So everything based on the finding. ठीक है, बहुत बढ़िया. ठीक है. हाँ. Now types of head bone fracture, very commonly asked 5 marks question. So this I'm going to share with you. So after the class, just go through this. So there are 3 types of fracture: inward compression fracture, outward compression fracture, avulsion fracture. Inward is common in manual strangulation, outward is common in hanging, avulsion is common in road traffic accident. This we can go through. Now this is the question asked in one of the university exam. Look at this question and try to answer. An 18-year-old male was found hanging by a leather belt. So 18-year male. Okay, very interesting question. Leather belt. You can see the leather belt here. Attached to a grill of the window. So it's a partial hanging. Partial hanging. Partial male. A mirror was found. Mirror is there. Mirror in front of the door, reflecting him in full length. So, I have hundreds of images of cases of autoerotic hanging. So, but because of the YouTube guidelines, I cannot show you all the images in, social media. Anyway, he was dressed in a woman's clothing. Dressed in a woman's clothing. That means it is transvestism. Sometimes it is associated with fetichism also. The room shows some magazine were spread over the floor. What is the name given to such a killing condition? Describe the postmortem findings and medico-legal aspects of such condition. What is this? So this is basically a case of autoerotic hanging. Autoerotic hanging. So what are the key features? One by one. The key features are: one is the presence of the partial hanging. Partial hanging, point number one. Point number two, mirror. Point number three, sexual paraphilia. Male, no history of depression. Okay. Naked, completely naked or partially naked. So go in favor of sexual hanging. Rest all same. And one more very important feature is protective clothing over the neck. Protective clothing present at the crime scene is a feature of autoerotic hanging or sexual hanging. Okay. Okay. So the next important question, that is the favorite of examiner, drowning. What is drowning? Types of drowning, postmortem findings, and medico-legal importance. Sometimes the question can be asked about difference between freshwater drowning and seawater drowning. Favorite of examiner. Okay. Good. Second image is funny. That's really funny, guys. But fun can lead to death sometime. Okay. This is the question asked in university exam. I think in RGHS exam. Cause of death, postmortem findings, medico-legal importance, definition of drowning. So let's go step by step. What is drowning? So drowning is form of asphyxia due to aspiration of fluid into air passages caused by submersion in water or other fluid. So it can be water or it can be some other fluid also. So this is the definition. Asphyxia, I said hypoxia, hypercapnia. Aspiration of fluid into air passages. What are air passages? That is basically trachea and lungs. Trachea and lungs. So that affect the exchange of gases, oxygen and carbon dioxide. So that leads to death. So death occurs in 5 to 6 minutes in freshwater drowning, 10 to 12 minutes in seawater drowning. Again, question asked. Freshwater. I'll have to write 5 to 6 minutes in freshwater. Seawater, death occurs in 10 to 12 minutes. Write this in chat box. Fresh, 5 minutes. Seawater, 10 minutes. Yeah. Okay. So what are types? Types are freshwater drowning, That means NaCl content is less than 0.9 percentage. So NaCl is less than 0.9, less than saline. So when there is a freshwater drowning, there will be hemodilution. The hemodilution can lead to RBC damage. RBC damage leads to release of potassium, leads to hyperkalemia. So it leads to hyperkalemia. Increase K+, very important funda. So this hyperkalemia causes ventricular fibrillation. As you know, normal potassium level in the body is 3.5 to 5 milliequivalents per liter. When it is more than 5, when it is more than 10, it leads to ventricular fibrillation and death. It's very dangerous. Okay. Then, seawater drowning. Seawater drowning, there will be pulmonary edema. So there will be pulmonary edema. So because of the high sodium and chloride content, it draws the blood from the, it draws the water from the blood. It enters into the lungs. It leads to pulmonary edema. It leads to hemoconcentration. So when there is a hemoconcentration, that can lead to myocardial anoxia. So this is again very important funda. So seawater, the potassium and the sodium level is very high. So when sodium level is very high, it draws the water from the blood, from the blood of the 5 to 6 liter blood is there, as you know. So from the blood, it enters into the lungs. It leads to pulmonary edema. So when there is a pulmonary edema, it causes more overload on the heart. And one more thing, it leads to hemoconcentration. Hemoconcentration leads to myocardial anoxia. So death occurs in 10 to 12 minutes. So this is the important line. Fine. Then dry drowning. See, dry drowning is basically theoretical. It is not a forensic opinion. It is not an autopsy finding. Dry drowning, the cause of death is laryngeal spasm. Laryngeal spasm. Larynx. So, adduction, abduction in ENT. When there is a sudden laryngeal spasm, the closure of the larynx, so there is no entry of the air into the lungs, that leads to death. So dry drowning, cause of death is laryngeal spasm. Then comes is immersion syndrome. Immersion syndrome known as hydrocution. So it is because of cold water drowning. Vasovagal inhibition. What is the cause of death? Vasovagal inhibition. A sudden dive in the cold water. The cold water can stimulate the vagus nerve ending. The vagus nerve acts on the heart. It inhibits the heart. It leads to cardiac arrest and death within few minutes. Vasovagal inhibition, immersion syndrome. Very, very important Viva question. Next comes is secondary drowning. The secondary drowning, the person dies because of secondary complications. Like example, cerebral complications. So there can be encephalitis. There can be peritoneal pleural effusions, peritonitis, pleuritis, and death. So secondary, the cause of death is secondary infections. Near drowning, when person survives, that condition known as near drowning, both are same. So near drowning, when person survives more than 24 hours after the incident, that is known as near drowning. Both are same. The cause of death is secondary drowning. The condition known as near drowning. So what is the cause of death? The cause of death can be asphyxia. The most common cause of death is asphyxia, no doubt. Or else it can be laryngeal spasm, vasovagal inhibition, secondary infection, that is in some rare conditions. So this is the definition, types of drowning and cause of death you need to write in the exam. Okay. बहुत बढ़िया, ठीक है, चलो. Now I have a question for you. The question is, say example, drowning. When do the body floats? When body floats after the death. For example, drowning. So a case of drowning. After how many days the body floats in the water? Can anyone answer this? This is very, very interesting question. Anyone? In case of immediately after the death due to drowning, the body sinks. The body goes to the bottom of the water. Once there is a formation of putrefactive gases, the specific gravity of the body decreases. So it floats. My question, when do it floats? How many days? 1 day, 2 day, 3 day, 5 day, 1 week? Can anyone answer? So the answer is 24 to 48 hours. So whatever is the condition, male, female, whatever is the condition, the body floats after 24 hours. If it is cold season, very cold season, then it can be 3 to 4 days. 3 to 4 days. Why? Because of the decomposition caused by the Clostridium welchii, hyaluronidase and lipase enzyme. Because of the gas, the body floats after 24 to 48 hours. Okay, so this is very, very important concept. Very good. Lion is answering, Rakesh is answering, and Darshan Patil. Very good, Rajesh. बहुत बढ़िया, all are answering. Great. Chalo. Now is it clear, guys? Definition, is it okay? Cause of death okay? So yes or no? Yes or no? Yes or no, guys? Let's make it interactive. You can keep yourself awake, myself awake. Let's make it forensic very interesting, very useful for our upcoming exam. Okay? बहुत बढ़िया, ठीक है, crystal clear. बहुत. चलो. Now, freshwater drowning, in 1 minute I'm going to explain. It causes hemodilution. It causes increased volume of blood, overload on the heart, ventricular fibrillation. On the other side, it causes dilution of the plasma, rupture of RBC, release of potassium, hyperkalemia, heart failure, and death. Death occurs in 5 to 6 minutes. So this is 3 marks question. No need to write anything. So I'm going to share these notes after the class. Just go through the notes. That's fine. Then, seawater drowning, hemoconcentration. Hemoconcentration causes hypovolemia. At the same time, it causes pulmonary edema, circulatory shock, heart failure, asystole, and death. Death occurs in 10 to 12 minutes. Again, 3 marks question. What is the pathophysiology of seawater drowning? Your answer must be pulmonary edema, hemoconcentration, circulatory shock, heart failure, asystole, death. हो गया. Now look at this now. Now say example. What is the cause of death in this particular condition? Especially cold water. When a person dives into cold water, suddenly dives into cold water, there can be death. My question, what would be the cause of death in that case? This is very interesting image. Come on, guys, one word answer. So vagus nerve, vagus nerve is inhibitory in heart. It's the largest cranial nerve. So when vagus nerve is stimulated, it causes sudden cardiac arrest. Like example in cafe coronary syndrome, pressure over the neck, slap over the cheek, All this leads to vasovagal inhibition, right? So what is the cause of death? Akash is telling. ठीक है. Good. Srinivas. Freshwater drowning and seawater drowning. Differences. So no need to worry anything. Just try to memorize. Freshwater drowning. In freshwater drowning, lungs are ballooned but light, pale pink in color. They are more emphysematous. Okay, so this word is important. This is again very important concept. I'm not going to discuss this theory basically. More emphysematous in case of fresh water, less emphysematous in sea water. This is what important. Okay. So again, this can be a 3 marks question. Fine. Next. Postmortem findings. The best part is the postmortem finding. Now let's make it interactive. So here is a case of drowning. Okay. Accidental drowning. So in this case, what we found cadaveric spasm, sand particles over the body, cyanosis, congestion, petechial hemorrhages, also the artifacts like aquatic animal bites. So here during Shawpariksha examination, during postmortem examination, so there is a finding here. What is this finding known as? Let's make it interactive. Let's debate. Externally, lung findings are there. Soham, lung findings are there. Externally, I don't think there are findings. No, I think. It's basically based on the Gettler test. Gettler test now outdated. Lung findings are classical. More emphysematous in fresh water, less emphysematous in case of sea water. So this table you can just go through Soham after the class. So size and weight, color, consistency, pleural effusion, sectioning, pulmonary surfactant, blood levels, all this. So this is more than sufficient. Okay, yeah. Now what is this finding? So this is basically known as froth. Okay, fresh lathery froth. So that increases on chest compression. Yes, this is the point number 1. Remember, it is a fine froth, very fine froth, not the coarse. It does not collapse. Okay, it do not collapse with the tip of the instrument. It is fine and it is constant. Then look at this. What is the shape? Can anyone tell me what is the shape of the froth? Again, it is given in the standard textbook, mushroom shape. Mushroom. Why froth occurs? The froth occurs because of the combination of water, surfactant, then mucus. Surfactant is made up of phosphatidylcholine and phosphatidylserine. When it combines with the water surfactant, so there will be mixing. So the mixing causes the froth. This can be asked in your exam. But again, one more important Viva question asked. What are the conditions in which froth is seen? Froth can be seen in various conditions, not only drowning, other conditions also. Differential diagnosis. Can anyone help me in this? Differential diagnosis. Froth कहाँ पे मिलता है? Is it only drowning or other conditions also? Is it specific? No, non-specific. ये non-specific है. Okay. ठीक है. Yes, very good. Kushal Patil is telling sir snake bite में होता है ये होता है snake bite में. बहुत बढ़िया. So cobra bite, common crate bite, it is commonly seen. Any condition of pulmonary edema froth can be seen. Opium poison, OP poison, it can be seen. Okay. Many conditions, 3-4 conditions we can mention. Okay. Now, what is the finding here over the face? Now look at this face. There is a finding here. Can anyone identify finding over the face? Both the eyes are closed. Froth is there at the mouth and nostril. Any other finding over the face? The finding here is postmortem hypostasis. Okay. So the postmortem hypostasis is there over the face. So that is one finding. And here there you can see some aquatic animal bite. So they are postmortem artifacts. Postmortem artifacts. And this froth is absent in case of dry drowning, in case of hydrocution or vasovagal inhibition. So this can be Viva question. When it is seen within 1 to 2 minutes after drowning. Within 1 to 2 minutes because of the breathing efforts. Froth everywhere. So trachea, lungs, oral cavity, even nostrils, everywhere froth is seen. It's one of the very important finding, froth. Froth is not seen in dry drowning and hydrocution. So then froth can be seen in epilepsy, it can be seen in electrocution, in other systemic conditions also. So try to memorize. It appears within 2 minutes after drowning. It's a fine white leathery foam at the mouth and nostril, looks like a mushroom. It do not collapse. Then it can be seen in various conditions. I said electrocution, epilepsy, opium, pulmonary edema, putrefaction and strangulation. Okay. Absent in dry drowning and immersion syndrome. Is it okay, guys? Is it okay? This finding is fine. Yes, freshwater drowning, it is seen more. Srinivas, in freshwater drowning, froth is more emphysematous, more froth is seen. It is seen in both the condition. Froth can be seen in seawater also, freshwater also, but extensive froth in freshwater drowning. Okay? Yes. Okay. In secondary drowning, no better. Secondary drowning, death occurs after few days, maybe 2 days, 3 days. So there can be some findings of froth. If there is a pulmonary edema there, it can be seen, but that we can diagnose very easily. ठीक है? Yes. बहुत बढ़िया. ठीक है, हो गया. आगे देखते हैं. This is one more story. See, this is a case of the drowning. In this drowning, we found some weights along with the dead body. So this was a case of suicidal drowning. During crime scene visit, we found some weights, maybe a 20 or 30 kg weight and a ligature around the body. So in this case, he tried to try to prevent identity and all that. That's okay. So what is this finding now? Look at the hand. Hand is somewhat bleached appearance. So classical soddening is there. So bleached appearance. Bleached. Soddening. Soddening मतलब heavy and watery. Watery. Bleached, soddening. So this is known as washer woman hand, and again it is non-specific. Why it occurs? Because of the water imbibition. Between epidermis and dermis, so the water enters. So there is a separation of epidermis and dermis. So that leads to washerwoman hand. Sometimes there can be deglowing also. Deglowing. So if it is seen over the fingers, 3 to 4 hours. If it is seen over the hand, entire hand, 24 hours. If there is a deglowing, 3 to 4 days. So my question here, what is the time since death? What is the time since death in this case? Come on guys, you can see here this image, soddening is there, watery hand is there, involving entire hand. So my question, time since death kya hai? What is the time since death? Is it 3 to 4 hours? Is it 24 hours? Is it 3 to 4 days? What is your answer? What is your take? Come on guys. Come on guys, come on. Yes, good, 24 hours. Answer is 24 hours. Yes, good question. It can be a washerman hand also. But in the standard textbook, it is given washerman hand. So soddening is the classical feature. Again, non-specific, it can be seen in case of trench foot, hypothermia and all. Okay? Non-specific, I said. Now the next important finding. So look at this. This is a case of accidental drowning. Accidental drowning. See hand. So hand, inside the hand, aquatic plants are there, mud is there. My question, what is this known as in case of drowning? And what is the importance of this? What it shows? So this is very, very important finding known as cadaveric spasm. Cadaveric spasm. It's a feature of ante-mortem drowning. So it can be seen in case of suicide or in case of homicide or accidental cases also, any condition. So it just shows the person was alive at the time of incident. He was alive. So sometimes it is confused with the rigor mortis also. In rigor mortis, the muscle contraction is not very strong, but in cadaveric spasm is very strong. No method can simulate like cadaveric spasm after death. So it is ante-mortem drowning. One of the very important finding. Good, many answered, many answered. Okay. Now look at this. So this is known as pernio, or we can say goose flesh. Goose flesh, because of the contraction of the subcutaneous muscle. It can be seen in hypothermia, so it can be seen in various conditions in case of drowning also. Now very important finding is the lung finding. Look at this lung. Lungs. In lungs there are two findings. One is emphysema aquosum. Second one, edema aquosum. So emphysema aquosum is commonly seen in conscious drowning. Edema aquosum in case of unconscious drowning. Edema aquosum is also known as watery lung. Emphysema aquosum is known as frothy lung. Okay. So during autopsy examination, Shava examination, if lungs are showing froth, extensive froth on cut section, less water, break in the continuity of the alveoli, then it is emphysema aquosum. So because of that, it's because of breathing efforts. The person is conscious, so there will be breathing efforts like this. Like this, breathing efforts will be there. Because of the breathing efforts, there will be damage of the alveolar epithelium. There will be more froth formation. So that is emphysema aquosum. If it is unconscious, if the person is unconscious, then water enters passively. That causes watery lung. So all of it write in the chat box. Emphysema is equal to frothy lung. Edema aquosum is equal to watery lung. Write this in chat box. Keep writing, keep writing. Now look at this now. This case, can anyone tell me, is it a conscious drowning, unconscious drowning? See, look at this lung. See, lungs are emphysematous. Lungs are like a balloon. Balloon. You can see the rib markings over the lung. You can also notice pult of hemorrhages. On cut section, froth is seen. So what is your inference? Is it conscious drowning or unconscious drowning? What is your take? Come on guys. Rib markings are there. Pult of hemorrhages are there. On cut section, froth is there. Alveolar epithelium is totally damaged. Okay. Emphysema, very good. So it's basically emphysematous lung. बहुत बढ़िया, ठीक है? I think hope you understood this. Now in some cases there will be pult of hemorrhages. Pult of hemorrhages. So they are larger. So they are larger in size, more than 2 centimeter. Okay, and they are commonly seen over the lower lobes. Lower lobes. All because of the breathing efforts. So breathing efforts. So breathing efforts leads to damage to the blood vessels. So blood vessels, venules can bleed. That leads to pult of hemorrhages. This is the 6th finding. 7th finding, there are some signs of drowning. So this you can write in exam. Sahad sign, Widler Threading sign, Sabinski sign and all. Sahad sign is micro rupture in gastric mucosa. Like example, this is the stomach. So this is the stomach. In stomach, you will see micro ruptures like this. So these micro ruptures are known as Sahad sign. Very important Viva question. Widler Threading sign. Widler Threading sign, it is about the contents of the stomach. 3 levels of contents in case of drowning. 3 levels are basically, the first level is the froth, the second level is the liquid, the third level is the solids. So stomach contents, when they are placed in, within a container, so there will be 3 levels. At the base, solids, then liquid and froth, especially in case of freshwater drowning. Sabinski's spleen, it's a small anemic spleen. So because of the hypoxia, so the spleen undergoes shrinkage, you can say atrophy. So the spleen becomes small and anemic spleen, that is known as Sabinski sign. Other signs also, if you mention these signs, that is fine. Sahad sign, Widler Threading sign, Sabinski sign. Now look at this now, this image. Now try to identify. So this is basically the container showing stomach contents. Look at this, stomach contents. So this is the froth. So this is basically fluid, and this is solid. All of you just repeat. What is this sign known as? What is this sign known as in case of drowning, guys? Try to answer. Okay. Try. Now the last point about the drowning is postmortem staining. So the postmortem staining commonly seen over the front of the chest. Front of the chest, lower limbs and lower part of the upper limbs. So this is the classical postmortem staining. So what happens actually? So after death, so the body, this is the position the dead body attains, like this. Head down position and buttock up position. head down, buttock up, head down, buttock up. So what is the site of hypostasis? Hypostasis seen over the front of the body, over the front of the face, front of the chest, front of the abdomen, lower part of the upper limb, lower part of the lower limbs. So all of you just type in the chat box, head down, V up position, V up position. Okay? So try to memorize this. This is again asked in INA-CET, NEET PG and FMG exam. Common site of postmortem hypostasis in case of drowning. Remember, head down, B up position. Head down, B up. Okay. So then the manner I said, it can be suicidal, it can be method of dowry death, it can be homicidal, it can be method of murder, so it can be accidental. So accidental even in swimmers also, like example hydrocution, vasovagal inhibition. So the manner, opinion of manner depends on the collective findings, many finding. So not only postmortem analysis but also crime scene visit, psychological autopsy, presence of depression, presence of injuries on the body. So everything matters in this case of drowning. Okay, so this completes your drowning. I hope you understood all the features of drowning, guys. So I'll just repeat everything now. So drowning, you need to write the definition. The form of asphyxia due to aspiration of fluid into air passages and all. Types of drowning, fresh water, sea water, dry water, immersion syndrome, secondary drowning, cause of death हो गया. इसके बाद fresh water drowning mechanism, this image you must write 2 mark. Then the sea water mechanism, myocardial anoxia and death. Then basically difference between fresh water and sea water. So there are, I think, some 10 findings are there given in standard textbook, you need to write. Then comes is the postmortem finding, froth, fresh leathery froth, absent in case of immersion syndrome, dry drowning. Then washerwoman hand, cadaveric spasm, goose flesh, lungs, that is emphysema aquosum in case of conscious drowning, edema aquosum in case of unconscious drowning, cult of hemorrhages, signs of drowning. There are many signs: Sad sign, Widler 3-ring sign, Sabinski sign. Then comes is the postmortem staining and the medico-legal importance. Is it okay, guys? So if you write all these points, you will get distinction mark in forensic medicine. Take my word. Distinction mark. That means 75 out of 100. 75, not only 75 but also 80 also. Mark my word. Yes, guys. ठीक है. Now difference between ligature strangulation and hanging. Difference between ligature strangulation and hanging. It can be 5 marks question. So can anyone tell me what is the difference? Let's make it interactive, guys. Hanging and ligature strangulation. Differences. 5 marks. So the first point, ligature mark is oblique. Here it is transverse. So this is the point number 1. Second point, in case of hanging, it is incomplete. Here it is complete. Then it is above thyroid cartilage. It is below thyroid cartilage. Then the base is dry hard parchmentization. Dry hard parchment. Here soft and red. Soft and red. Thyroid cartilage damage very rare. Here thyroid cartilage damage is very common. We see. Any other? Ligature strangulation. Very good. I think some students are answering. Ranjan is telling, sir, okay. Adduction fracture, very good. Darshan Patil. Hanging, there will be adduction fracture or abduction fracture. So both are basically outward compression fracture, abduction fracture, right? Abduction fracture. Here also outward, both are same. Outward, outward. This is a similarity, not the difference. Here in hanging, no suspension. So hanging suspension is there. Suspension होता है. But ligature strangulation में suspension absent. Suspension absent. So in both the conditions, CPC is very common. CPC commonly seen. Okay. So 3 marks question, sometimes 5 marks question, or it can be part of the main question. So there are differences are there. You just go through this findings. So facial findings like color, impetical hemorrhages, bleeding, protrusion, salivary stain, laugh is sympathetic. So this I am going to share with you. Just go through this. Then ligature mark direction, complete, incomplete, above, below thyroid cartilage, and the base. Okay, there are 10 differences are there. 10 differences. At the end of the class, you just go through this. Yes, चलो आगे देखते हैं next question. Types of suffocation. Types of suffocation. 5 marks question. So can anyone tell me one type? Suffocation. Suffocation is a diagnosis of exclusion. It includes any condition of asphyxia other than drowning, other than hanging, other than strangulation. What are types of suffocation? There are 10 types are there. What are they? 111. Come on guys, let's make it interactive. One by one. So one type is, there are 10 types are there. Okay. So 10 types in exam you need to write. The first one is environmental suffocation. Environmental suffocation. That is the first one. Then, so when there is a decreased oxygen in the environment, so that leads to death due to suffocation. Like example, acute mountain sickness or decompression sickness, or in case of children's found dead within empty fridge, okay, empty box, suffocation. Okay, that is the first one. Then smothering, बहुत बढ़िया, smothering, very good. Smothering answer given by some of the students. So Darshan Patil is telling smothering, that is occlusion of external air passages, like this is smothering. Okay, smothering, occlusion of external air passages, again leading to CPC. There can be a fracture of the nasal cartilage, nasal bone. So there can be injuries over the buccal mucosa, bruises can be seen. So again, it needs a thorough examination. That is smothering. Then some students said, sir, garroting. No, better garroting is a type of strangulation. Choking is correct answer. Choking. That is basically occlusion of the internal air passages. In children's, it's very common. Heimlich maneuver you can mention in the exam. Choking ho gaya. Then gagging, I think nobody has answered gagging. So gagging, that is mouth gag up to pharynx, that leads to asphyxia and death. Then some student answered, sir, burking, cafe coronary syndrome, cafe coronary syndrome. Okay. Then it can be wedging, wedging, positional asphyxia, positional asphyxia. It can be traumatic asphyxia, traumatic asphyxia. And lastly, any other method? Cafe coronary, gagging, bucking, overlying. So gagging, हाँ ठीक है, बहुत बढ़िया. Any other type other than this? Choking हो गया, cafe coronary हो गया, banana syndrome, wedging, positional asphyxia, traumatic asphyxia. ठीक है. One more, anything from the standard textbook? Which I forgot is overlaying. Yes, some student answered me. Yeah, overlaying. Good. Overlaying. Now let's summarize each one. Let's summarize. See, smothering means external air passages. Choking means internal air passages. Okay. Gagging, that is occlusion of the pharynx. Occlusion of the pharynx. Okay. Now look at this. Now I am showing. See this. This is what? Inside the mouth up to pharynx. ये क्या है बताओ? All of you guys. So when a gag is placed within the mouth, especially in case of rape, so or sometime in case of kidnapping, abduction, in case of murder, they place a gag so inside the oral cavity. So this lodges over the pharynx like this, lodges over the pharynx and leads to death. So up to pharynx we call it as gagging. समझ में आ रहा है ना? ठीक है ना? ठीक है. So burking, what is burking? So burking is a very famous method followed by William Hare and William Burke. So they practiced this method to supply dead bodies to medical college. They used to do business in dead body. They used to supply dead bodies to some anatomy professor Robert Knox in Edinburgh Medical School. They used to invite friends, sometimes beggars to their house. They used to provide alcohol. So after giving alcohol, when overdose, that leads to unconsciousness. So William Hare and Burke used to kill them by two methods. So burking is homicidal smothering. Homicidal smothering and traumatic asphyxia. Traumatic asphyxia. So the William Hare used to close the mouth and nostril. I think William Burke, and he also used to sit on the chest of the victim. And William Hare used to drag the victim around the room, so leading to death. So that is burking, an infamous method known as body snatcher syndrome. Cafe coronary. Cafe coronary, remember, it is a banana syndrome. It is very common in alcoholics. Alcoholics. Wedging. So wedging between the wedging or abnormal position, sometimes wedging between the two objects, especially in children's, alcoholic persons, abnormal sleep position, so that can lead to wedging and death. Positional asphyxia, almost same like a wedging only. Again, very common in case of torture, in case of alcoholics. Positional torture methods like hog tie method and all. Traumatic asphyxia because of the trauma, because of the heavy weight, which falls over the victim chest, which causes inability to do inspiration and expiration. So that is known as mask ecchymotica. So there are classical features like deep cyanosis, petechial hemorrhages, and red line of demarcation. Then overlying, that is very common in case of infant death. Infants. If you mention this, I think you will get 3 out of 3 or sometime 4 out of 5. That's okay. Fine, that's okay. Then now suffocation I said. Bahut badhiya. Now look at this now. Cafe coronary syndrome. So remember, cafe coronary syndrome is also known as banana syndrome. Write this in chat box. Cafe coronary is equal to banana syndrome. So the cause of death is vasovagal inhibition. In cafe coronary, there is a sudden death. CPC absent. CPC absent. So reflex because of the alcohol. So reflexes are absent. All of you type this. Cafe coronary is equal to banana syndrome. Okay, I'll explain this. Don't worry. I'll explain this. Hello. देखते हैं now. Now look at this. This is a very very interesting case. Now history. देखते हैं पहले history क्या है. 60-year-old man. So cafe coronary common in old age. 60-year-old man died suddenly while having food in a bar and restaurant. So he found dead in a bar and restaurant while having food. He was non-vegetarian or he was vegetarian, I don't know. He was found dead. People thought it is a heart attack. But CPC absent, congestion, petechial hemorrhages, cyanosis absent. An autopsy, foreign body was found in the larynx. It is known as cafe coronary because most of the death occur within bar and restaurant. It is known as coronary because it resembles like heart attack, coronary artery attack, that is the heart attack, myocardial infarction. Now look at this dead body here. So I think here is the Shava Pariksha finding. In Shava Pariksha, what you can see here, some froth is there, some mucus or some banana is there around the nostril, and you can see the face is not congested. Tongue is slightly protruded, we can see, and further examination you can see here this one, this image. Yeah, you can make out now. So this picture, the tongue is there, you can make out this tongue, and this is the banana. So this is the banana which is found in the larynx, and this banana piece stimulating recurrent laryngeal nerve and superior laryngeal nerve, leading to vasovagal inhibition, cardiac arrest and death. So this is classical cafe coronary syndrome. Now question is how to differentiate between choking and cafe coronary syndrome. Choking and cafe coronary syndrome. Remember, in choking there will be some signs and symptoms. Like example, cough will be there, severe cough. The patient will be having unable to speak, unable to talk. There will be some breathing efforts will be there. Death occurs in 3 to 5 minutes, not immediately. But in this case, death occurs immediately. So having alcohol and having non-veg diet, so that leads to death immediately within few seconds. CPC absent. So this can be Viva question. Yes, good. समझ में आ गया ना? Srinivasan, are you getting my point? Oh, chalo, okay. Now differences. There are 11 differences are there, choking and cafe coronary. So this can be a 5 marks question. So you must go through this table after the class. All of you okay? Have you understood banana syndrome? Banana is there, alcohol is there. So forensic is very interesting, guys. I feel forensic is very interesting and very lovely. Why? Because we have lot of cases in forensic and a lot of real cases. So it's a very challenging, like Booth Bungalow series, crime stories. So solving crime story, it's something really challenging, I feel. What is your opinion about forensic medicine? What is your opinion? What about the opinion? Fine, guys. Srinivas. Okay. Hello. So this, okay, we completed hanging, we completed drowning, we completed hanging and difference between hanging and ligature strangulation, types of head bone fracture, types of suffocation, and banana syndrome, and choking and banana syndrome, English maneuver and all. We discussed about freshwater drowning, saltwater drowning, cause of death, lay faces sympathetic, everything we covered. So we have some more topics are there. So okay. Chalo, chalo. Good, good, good. Rakesh. Next, I have a question for you, a part of the Booth Bungalow series. Silent while speaking, speaks when dead. लाश एक मुंह गवाह है जो कभी झूठ नहीं बोलती. लाश, डेड बॉडी एक मुंह गवाह है जो कभी झूठ नहीं बोलती. Now look at this case. This case, you need to explain me what is the cause of death in this case. The history is 52-year-old female, unable to talk and presented with quadriplegia. Dyspnea, misleading history was given by relatives. So my question is, what is the probable cause of death in this case? Look at this. In this case, you can make out here over the neck. So the history given is natural history, some normal history is given by relatives, some choking or some gagging. But during crime scene visit, during shop examination, I found some fingernail marks are there. You can make out here, there are fingernail marks. And on further examination, the neck shows hematoma is there. So clearly visible hematoma is there. So what is your opinion about it? Is it homicide or is it natural death? 52-year-old female, unable to talk, quadriplegia, weakness of all the four limbs, difficulty in breathing, admitted to emergency, and found dead after some few hours. But dead body was taken into forensic department as per 194 BNSS. The postmortem was conducted. Over the postmortem examination of the neck, there are some fingernail marks are there. Some are vertical, some are horizontal. So my question, is it natural death or some doubt is there, some suspicion is there? Now you are Salunki, you need to explain me. Come on guys. Homicide. Kushal Patil is telling, sir, a homicide hai. Good, very good. So this is the classical case of manual strangulation. We found there was a clear-cut findings, fingernail abrasions and hematoma. This is manual strangulation. In manual strangulation, I said in my classes, there will be fingernail marks, there will be hematoma, 6 penny bruises. So this is classical manual strangulation. This is throttling, manual strangulation. What is forensic medicine? Application of medical knowledge in administration of justice. So this is how you can help the justice. Yes or no? Okay? Yes. Throttling, Burking, Bansdola, very commonly asked. All are very important question. Throttling can be 5 marks question. Burking 3 marks question. Bansdola 3 marks. Garroting 3 marks. Okay. Good. चलो आगे देखते हैं. Now throttling. So this is classical throttling. So the occlusion of neck, the compression of neck by using one hand or both the hand is known as throttling. So what are the findings in case of throttling? You need to write all these findings. Over the head, over the face, there will be congestion along with the petechial hemorrhages. Eyes are very prominent. We can call it as protruded eye. Protruded eye is very common in case of manual strangulation. Subconjunctival hemorrhages, large hemorrhages, protruded tongue, neck that shows irregular bruises. Irregular bruises are known as sixpenny bruises. Sixpenny bruises. Sixpenny. How it looks? Let's discuss how it looks. Look at this. Example, this is the neck. So this is the neck of the victim. Okay. The sixpenny bruise, they are seen around the neck like this. Like this. If both the hands are used, it looks like this. If one hand is used, sixpenny bruise are present on the one side of neck. And in case of throttling, there can be vertical fingernail abrasions where basically victim fingernails like this. Victim fingernails. Horizontal fingernails, they are curved like a comma, they are basically of accused. And in case of manual strangulation throttling, there will be involuntary discharge of feces, urine, there will be evidence of struggle. So there will be lots of struggle. There can be abrasion, there can be bruises, there can be sometimes lacerations. So the crime scene is going to give you a lot of clues about the manual strangulation. So this is a 5 marks question. This is how you need to write in the exam. Okay. Yes, Mohammed Shahid, Rajesh, is it okay? Throttling, can you able to write? Come on guys, come on. Ranjan, Srinivas. Okay, throttling is over. The next, now look at this. What is this method of strangulation known as? That is constriction of neck in elbow bend or in the knee bend like this. Elbow bend or knee bend. What is that known as? One try. Muhammad Shahid, Srinivas. What is this? This is known as mugging. Again, mugging can be 3 marks question. Mugging. So it's a strangulation caused by holding the neck of the victim in the bend of the elbow, bend of the knee. There are 2 types of mugging, choke hold and carotid sleeper hold. Then again, external findings, they are minimal. There can be bruises, there can be contusions. The cause of death is asphyxia, vasovagal inhibition. So this is more than enough for the 3 marks question. There are 2 types are there. One is the choke hold. The second one is the carotid sleeper hold. If forearm is placed across the front of the neck, like this, front of the neck, that is choke hold. If bend of elbow is placed at the front of the neck in a midline, so that is known as carotid sleeper hold. Carotid sleeper hold. There are 2 types are there. Okay. So now look at this. Now what is this? Is this carotid sleeper hold or choke hold? Look at this. Here neck is constricted at the elbow band, and this is occluding their carotid artery. My question, is it a carotid sleeper hold or it is choke hold? Sometimes the question can be asked in Viva. Come on guys. So this is carotid sleeper hold. This is chokehold. Chokehold, carotid sleeper hold. Okay, good. Many answered. That's okay. Now I have one more important topic. Look at this video now. This video. Here is the video. In this video, or in this method of strangulation, one iron rod is placed over the front. Okay, placed over the front and the back. One end is tied. So another end there will be twisting. So it can be iron rod, it can be bamboo stick, it can be any apparatus. What is this method of strangulation known as? Let's play once again this video. Try to memorize this. So this is classical Vansdola. Vansdola. Then garroting. What is garroting? Again, this is commonly asked 3 marks question. See, garroting is a type of strangulation in which assailant, usually from the behind, without warning, throws a loop of ligature around the neck of the victim and quickly tightens by twisting with a lever, causing sudden loss of consciousness, collapse and leading to death. So garroting is a type of strangulation. Point number 1. Point number 2, it leads to sudden death. Sudden death. Death occurs within few minutes, or we can say 1 or 2 minutes. So because of the sudden death, CPC very minimal. So CPC can be very minimal. Okay. One method of garroting is known as Spanish windlass. Spanish windlass. It is practiced in Spain. So they are going to place some iron ligature material, some metallic ligature material around the neck. They are going to tighten it from the behind, leading to death of the person. It was practiced in Spain and Turkey. That's why it is known as Spanish windlass. Wind means trachea. Lass means loss. This can be 3 marks question. What is Spanish windlass? And related 3 marks question. Okay. Now look at this now. This one. What is this, guys? Step 1, step 2, step 3. There are 2 images are there. Here is the step 1. The assailant is attacking the victim without warning, placing a ligature around the neck, leading to sudden loss of consciousness and death. What is this known as? Yes, anyone? Can you try? What is this method? Akash? So this is garroting. Garroting. Now one more image for you. Look at this. Here is victim. You can see the victim here. No suspension. No suspension of the body. No suspension. Ligature material is around the neck. Ligature material around the neck, twisted with the help of the lever. What is this known as? So this is known as Spanish windlass. Spanish windlass. Okay, carotene. Okay. Yes, fine. Then I have few spotters, guys. Few spotters in next 10-15 minutes. Yes. Shall we start the spotters? Are you there? Last 5-10 minutes. Ranjan, Akash, Rajesh, Rakesh. Shall we start spotters? So one spotter, 2 minutes only, not more than that. Let's complete by 9 o'clock. All the 10 spotters in 15 to 20 minutes. Chalo. Okay, fine. The first spotter. So very commonly asked in forensic FMT spotter. There is a plant given. The plant has pink color flower or white color flower. It is used in criminal abortion. It is also used in artificial bruise. What is this plant known as? What is the toxic principle? So this plant can be two types. White color flower. If white color flower is there, the name differs. Pink flower is there, then the name differs. It is used in criminal abortion. Artificial bruise. Criminal abortion punishable under 88, 89, 90 BNS. The active principle is calotropin, calatoxin. Okay, calotropin, calatoxin, gigatin. So what is the best answer, guys? Good. Many got the answer. First to answer by Ranjan. Ranjan beta, very good. Calotropis. It is a calotropis plant. Done. Good. Great answer. Next. Now here is the case of organic irritant, snake. The snake having transverse white line, steel black in color, very fatal, very cunning snake like Katapa. It has a tendency to bite people in their sleep. Very toxic. 3 to 6 milligram can lead to death. It leads to paralysis, mild convulsions, and death occurs in 6 to 8 hours. What is this snake known as? This snake. Okay, now you try. Now the next question by Rakesh Kushal Patil. Crate answer. So this is basically common crate. The common crate is neurotoxic. 3 to 6 milligram fatal dosage. Treatment is ASV. It resembles like stroke. It is presynaptic. Very poisonous. Very poisonous. Very common in India. So it's a neurotoxic. It comes under Elapidae. Elapidae. So Elapidae, Viperidae, and Hydropidae. So there are 3 classes of snakes in forensic medicine. Elapidae means neurotoxic. Viperidae, hemotoxic. Hydropidae, they are myotoxic. They lead to myotoxicity and death. So this is common crate. I think many answered. Ranjan answered. Rakesh, Kushal Patil, Soham, Yes, many. Rajesh also answered. That's great. Okay. Then, now one more very important FMT spotter, very commonly asked in the exam. Look at this, kidney shaped seeds are there. Kidney shaped, double edged, resemble like a chili seeds. Fatal dosage 100 seeds. It leads to delirium. The treatment of choice, physostigmine. It leads to 9D manifestation. What is this? So this is basically Datura. Very good. Not chili seeds. Kushal Patil and others. Soham, correct answer. This is the Datura seeds. Datura. So this is Datura fruit known as thorn apple. Now the fourth one. The fourth one, it's a poisonous plant, and from this castor seeds are made. The castor seeds are very poisonous. It's an agent of bioterrorism. It's an organic irritant. It causes brain hemorrhages, liver hemorrhages, and death. So one very famous case is umbrella murder case. So my clue is umbrella murder case. Umbrella murder case. It's organic irritant. Organic irritant. You can see here they are in clusters. It is not Datura. Though it has spiny projections, it is not Datura. It is something else. What is this plant? Yes, Akash, very good. So this is castor. Castor. Scientific name is Ricinus communis. Ricinus communis. Fatal dosage 10 seeds. It inhibits RNA polymerase. It inhibits the protein synthesis. It causes cell death. It's category P agent of bioterrorism. Fourth, okay, done. बहुत बढ़िया. Next, आगे देखते हैं. Now all these are castor seeds. Now look at this plant. So this plant, so very poisonous. It is used in preparation of heroin. The cultivation of this plant is punishable under NDPS Act 1985. So it can consist of natural alkaloid, like example morphine. The seeds are non-poisonous. Only the plant is poisonous. So what is this plant known as? What is the medico-legal importance? So yes, plant, guys. So good, many answered. So this is poppy plant. Scientific name is Papaver somniferum. So medico-legal importance, it's a drug of abuse. It leads to very high physical dependence and psychological dependence. It is also ideal infanticide agent. It is used in infanticide. Okay, Papaver somniferum, poppy seeds. Good, many answered. That's great. Akash, Kushal Patil, Rakesh, others, great. Now look at this. So this is again very poisonous. It is used in killing of street dogs. Okay, street dogs. ये क्या है? Yeah. So what is the plant name? Look at the seeds. Seeds are concavo convex one seed is lead to death. It is bitter in taste. It resembles like tetanus. It's a spinal poison. It leads to opisthotonus, pleurostotonus, emprosthotonus, and it leads to respiratory failure and death. It is basically postsynaptic. It competes with the glycine. It inhibits the action of glycine. It increases the activity of glutamate. The consciousness is maintained till last stage. Wenzel test and other tests are commonly done. What is the poison here? So this is classical Nux-vomica. So the active principle is strychnine. Strychnine. So I think yes, Rajesh, good. Ranjan, Akash, Rakesh, Rajesh, good. Many answer. Nux-vomica. This is Nux-vomica plant. Then this is one more very commonly asked question in exam as a spotter. Here is the ideal homicidal agent. We call it as king of all poisons. Colorless, tasteless, odorless compound mixed with any food and drink. Signs and symptoms resemble like cholera. The fatal dosage 200 milligram. It leads to rice watery stool. It leads to raindrop pigmentation. Aldrich measline. What is this? So this is arsenic trioxide, also known as Sankhya. Okay, arsenic trioxide. Nobody has answered. So many answered only arsenic. It is arsenic trioxide. It's ideal homicidal. All of you write in the chat box. Arsenic is equal to king of all poison. King of poisons. Keep writing. Arsenic is equal to king of all poison. Okay. Now look at this. So this is again a heavy metal poison which can lead to many complications. एक चुटकी सिंदूर की कीमत तुम क्या जानो Ramesh Babu. My question is, what is this red color compound which is basically preparation of heavy metals? So it can be anything. So many preparation can be red in color. What is the common preparation which looks red in color like a blood stain? What is this compound? Sindoor. Om Shanti Om movie, you know, one of the famous movie, one of my favorite movie during my UG days. एक चुटकी सिंदूर की कीमत तुम क्या जानो रमेश बाबू. बताओ रमेश बाबू कि क्या है? Rajesh, Rakesh, good answer. This is mercury sulfide. Mercury sulfide or lead tetroxide. Lead tetroxide. So lead causes plumbism. Mercury causes Pink's disease, Minimata disease. So Pink's, Minimata, all these are name given to mercury sulfide. Yes, guys. Good. Then the question number 9. Question number 9, it is nothing to do with the image. Test for alcohol concentration in body. What are the tests done to find out the amount of alcohol present in the body? So, anyone, can you try? Alcohol means ethyl alcohol. What are tests done? So, there are many tests. So, one is Kozelka test, Kevet test, breath analyzer. No, breath analyzer is basically for breath analysis, not for the blood analysis. Then gas chromatography. So the question can be asked about Widmark formula. Can anyone try what is Widmark formula? What is Widmark? So Kozelka, Kevet test, Henry's principle of breath analyzer, gas chromatography. Okay. There are 4 tests are there. What is Widmark formula? Widmark formula. One formula is there. What is that? Formula is A is equal to CPC. A is equal to CPR. So amount of alcohol present in the body is equal to concentration of alcohol in the blood. P is the body weight, R is the constant. So this is very commonly asked 3 marks question. So this can be used in blood as well as the urine. But the formula that differs. If it is urine, the formula differs. Okay. And in alcohol, there are 3 stages. Stage of excitement, stage of incoordination, then stage of coma and all. There are 3 stages are there. Legal limit of alcohol is 30 milligram percentage. So as per Motor Vehicle Act, section 1985, section 185 of 1985 Act, the legal limit of alcohol is 30 milligram percentage. Anything more than 30, that is a punishable offense. Okay. Then A is equal to CPR. That's great. Now look at these seeds. Again, these are all very poisonous seeds. So these seeds are usually mixed with the moong dal, mixed with the dal. So as a part of the food adulteration, it can lead to neurotoxicity. It can lead to neurotoxicity. It can lead to paralysis. So what is this seeds known as? Can anyone try? So yes, very good. It is basically Kesari dal. Kesari dal. The toxic principle is VOAA, beta oxalyl amino alanine. So which leads to a condition known as latheriasis. And try to memorize one more very commonly asked question. Argemona mexicana. Argemona mexicana leads to epidemic dropsy. So this increases venous permeability, glaucoma, edema and death. This can be MCQ. One more, endemic ascites. Can anyone tell me what is endemic ascites? What is the toxic principle leads to endemic ascites? Yes, come on guys. Are you tired? Rakesh, Akash, Ranjan, batao, jaldi batao. You need to answer now. This is very, very important question. Endemic ascites caused by pyrrozolidin. That is Zunzunia plant, which is basically hepatotoxic. So after the class, just go through this notes. Neuroletheriasis, epidemic dropsy, endemic ascites, all are very, very important questions. So the toxin in epidemic dropsy is sanguinary, I said. So this completes today's session, the first session of FARRE 3.2. So we completed asphyxial death in detail in 2 hours. So I hope this session is useful. This session is useful for your upcoming exam. So we completed hanging in detail, strangulation in detail, drowning and suffocation. We completed all the questions, all important 3-liners, the 3 marks question, 5 marks question, long essay, and image based questions, banana syndrome, choking. In the end, we discussed a few important spotters because toxicology is very vast. So we are going to discuss at least 10 spotters in every class. So that's it about today's session. Yes, guys, Akash, so Pish, Bhatia, Soham, I hope you are enjoying forensic classes. Any suggestion from your side? Am I very slow, very fast? Am I very boring or very interesting? So just give me suggestion. Your suggestions are very important for me to grow as a teacher, grow as a student. So yes, guys. Okay. Thank you all, Rakesh. Thank you. Very interesting. Perfect. Fine. So, Rajesh, okay. See, when I teach fast now, it becomes little problem for other students. So, Akash, okay.